Hello everyone, welcome back to the video. Dr. Christine Smith here again. What we're going to talk about today is emotion. There are three major topics in the chapter on emotion, as you'll see. We have theories of emotion, what are emotions and why do we have them. There's a section on attack and escape behavior, such as fear and anxiety. And finally, there's a section on stress and health. Today, what we're going to cover is theories of emotions. So, in asking what is emotion, psychologists define emotion in terms of three components. They define it in terms of cognition, action, and feeling. We can further define emotions by several subjective characteristics. Most psychologists in Western cultures see emotions as organized psychological and physiological reactions to changes in our relationship to the world. These reactions are partly private, are subjective experiences, and partly objectively measurable patterns of behavior and physiological arousal. The subjective experience of emotion has several characteristics listed here. Emotion is usually temporary, it tends to have a relatively clear beginning and end, and a relatively short duration. We can contrast this to moods, which generally lasts longer. Emotional experiences are either positive or negative, either pleasant or unpleasant. Emotional experiences are triggered partly by your thoughts, so it's triggered partly by your mental assessment of how the situation relates to your goals. For example, the same event can bring about two different emotions depending on your cognitive interpretation of what the event means. An exam score of 75%, for example, could excite you if your previous score had been a 50, but it might upset you if your previous score had been a 90. We know that emotions are complex events. People subjectively experience happiness or sadness, but they also experience important changes in their body and their face. Emotional experiences alter thought processes as well. They often do this by directing attention towards some things and away from others. Negative emotions tend to narrow attention, and positive emotions tend to broaden it. Anxiety, for example, narrows our attention focus on potential threats to the environment. Emotional experience triggers an action tendency, which is the motivation to behave in certain ways. Positive emotions, like joy, contentment, and pride, often lead to things like playfulness, creativity, and exploration of the environment. This behaviors, in turn, can generate further positive emotions by creating stronger social ties, greater skills in problem solving. The result may be an upward spiral of positivity. Negative emotions, such as sadness and fear, often promote withdrawal from threatening situations, whereas anger might lead to actions like revenge to construct change. Finally, on our list, we have emotional experiences, are passions that happen to you. Usually, whether you want them to or not, you can exert at least some control over emotions in the sense that they partly depend on how you interpret a situation. For example, your emotional reaction might be less extreme after a house fire if you remind yourself that no one was hurt and that you have insurance. Still, the control is limited. You can't decide to experience joy or sorrow. And sad things happen to you, like you fall in love, or explode in anger, or overcome by grief. Emotional experiences, much like personality traits, have a different relation to the self than do conscious thoughts. The question of what causes the bodily reaction and emotion has yet to be answered. However, there are a number of possible explanations. The most natural argument is that the subjective experience drives the physiological reactions, so our physiological changes, like trembling or gasping, or increased heart rate, happens because some event has happened that causes us to be afraid. This is the common sense theory. The common sense theory is that, for example, you see a bear, you become afraid, and your body has a physiological reaction. This is actually pretty much a rejected theory. In 1890, James Lange saw the common sense theory as backwards. He thought that the more rational view was that we feel sorry because we cry, or angry because we strike out, or afraid because we tremble. Not that we cry, strike, or tremble because we are sad, angry, or scared. So the idea that the bodily reaction drives subjective experience of emotion is known as the James Lange theory of emotion. The sources of emotions in this theory are created by awareness of specific patterns of peripheral or autonomic responses. Another example is that anger is associated with the increased blood flow in the hands and feet. Fear is associated with decreased blood flow to these areas. This theory states that there are specific physiological responses to different emotional responses. For example, fear most accompanies a specific set of physical responses. Happiness has its own set, sadness has its own, and so on. But think of a problem. Imagine how you feel before a big exam, and imagine how you feel before a big date. One might be anxiety, one might be excitement, but they may share some physiological characteristics. Not surprisingly, there are critics of the James Lange theory. One problem with it, for example, is this problem with how you feel before a big test or a big date with somebody you really like. You might have sweaty palms, butterflies in your stomach. So the question is, would you say the emotions associated with both of these are the same? You can argue that you have very similar physical responses that result in different subjective emotional experiences. So Walter Cannon, a physiologist, proposed that body reactions and subjective experiences happen at the same time but independently. Cannon recognized that the body reactions is essentially in the same way to most emotional experiences. He believed that emotions and arousal occur at the same time, but not that one causes the other. So the brain is a source of generation of emotion. To this point, we have discussed three theories of emotion: common sense, James Lange, and Cannon-Bard. None of these theories of emotions actually are looked upon very favorably these days. The major problem is that they fail to take into account of the cognitive side of emotion. This figure demonstrates a study done in the 1960s by Schachter and Singer to demonstrate the cognitive part of emotional experience. Volunteer subjects were injected with a drug that produced symptoms of physiological arousal. Half of the subjects were informed about the drug's effect, the others were not. When placed in a room with a euphoric or angry accomplice, only the uninformed subjects adapted to the same mood. Presumably, the informed subjects attributed their arousal symptoms to the drug, whereas the uninformed subjects interpreted the symptoms as emotional experience. This is known as a two-factor theory. The key here is that your emotional response will be based on your cognitive interpretation of the event. It is how you interpret arousal that will determine your experience. You're scared when you face a bear in the woods, not because of your body arousal, but also because your mind understands that what is causing the arousal is dangerous. You label the arousal and thereby determine the emotion that is experienced. So, to summarize, the common sense theory, we have the subjective experience driving the body response. James Lange theory, we have the body response driving the subjective experience. In the Cannon-Bard theory, we have the body response and the subjective experience happening at the same time, but they are different processes. And finally, the two-factor theory, where we have the body response, we have an interpretation, a cognitive interpretation of the response, and then we experience a subjective emotion. Alright, well that's it for today's video. Thank you again for watching, and I'll see you next time.